Let's clean a patient's teeth who smokes cigarettes. Here's the before photo. Note the bright light. It's not that good of an image. Oh, here we go. It's better without the bright light. There you go. So we can see the stains on the teeth themselves, especially around the margins of the filling. So let's jump right in and clean these teeth. First things first, before the cleaning, we will do an oral cancer screening. You can see the clinician checking the sides of the tongue here. Whether you are a smoker or a non-smoker, everyone should be getting oral cancer screenings at the routine cleaning appointments. I will link my oral cancer videos if you'd like to learn more, but for the purpose of this video, just be aware that smoking does increase your chance of developing oral cancer, and the most common spots are the sides of the tongue and the floor of the mouth underneath the tongue. Next up, Perio charting. Again, this should be done on every single patient, whether or not you smoke. But for those who do smoke, it's super important. This is because smoking actually dries out your mouth and reduces blood flow to the gums. So as a result, the evident clear appearance of gum disease is often hidden. The gums usually won't swell or bleed during the onset of gum disease if you're a smoker, like they would with non-smokers. So although the gums may look healthy, they may not be. And we won't know until we take those measurements with the Perio probe, as you see here. You might hear the clinician call out numbers, or maybe they type them quietly into their computer. Whatever the case, for this patient, this is a Perio maintenance appointment. So they already had a deep cleaning and now they are maintaining their gums. But if this were to be the first initial appointment, then these numbers would help determine which type of cleaning is best for the mouth. And if you want to learn more about Perio charting and probing measurements, I'll also link that video of mine in the description box. Now onto the cleaning. We would usually start with the ultrasonic. There will be lots of water and suction noises. The ultrasonic scaler is great at removing plaque, tartar, and stain. The ultrasonic uses a combination of both high pressurized water and ultrasonic vibrations to remove the plaque and tartar, as well as doing a great job at removing stain, as you can see here. They are really working on that spot between the margin of the filling and the tooth. Most of the time, when fillings themselves are stained, a cleaning won't totally remove the stain. However, in this case, it's definitely helping at the margin area. But yes, in general, the most noticeable thing on most smokers' teeth is the staining, right? This is because tobacco products, whether it's smoking, dip, or otherwise, they tend to soak into the porous tooth enamel. And in time, all those stain particles can actually become so ingrained into the teeth that they become internal tooth stain. So depending on whether the stains are external or internal, that will depend on how much whiter the teeth will appear after a cleaning. So for this patient, look how great those stains already look, like they're already gone. We haven't even polished yet. You'll see the polishing in just a second. But yeah, this is great progress to see. The ultrasonic scaler removed a good amount of that external stain. I love seeing the transformation as it's happening throughout the appointment. It is so cool. And now onto the hand instruments. These are great at fine tuning and removing the residual plaque and tartar, and even sometimes stain as well on the teeth. For a thorough cleaning, most clinicians will use both the ultrasonic scaler and then the hand instruments as well. After they are done with the scaling portion, then they will most likely polish. So like I said, any mild surface stains, extrinsic stain from smoking, like the smoke, as well as from food, coffee, wine, tea, etc. Whatever the stain is, as long as it's extrinsic, all that stuff can be polished off during the polishing process. You usually get to pick a flavor, and it's like a gritty toothpaste that helps make the tooth surfaces smooth, so plaque is less likely to adhere to the surface. Also, it makes you feel nice and fresh. After polishing, they may check with the air, blowing some air on areas to check their work. So this is because when there's saliva or bubbly spit sitting on your teeth, it's sometimes hard to see, right? So that's why we like to use the air to blow away the spit bubbles. And lastly, we floss. Not only does the floss clean between all of the teeth, but in addition, it helps confirm that we don't miss any spots, right? When the floss goes up and down smoothly between each tooth, then we know they are in fact clean and smooth. Okay, so now let's check the before and after photos. I think this is amazing. The teeth look super, super clean. Of course, there's a few areas of internal staining, the internal stains that we cannot remove, and some fillings are stained. And like we said, those are the types of stains that can't be cleaned. But if you want to talk with your dental provider about whitening options and or replacing old fillings, those are some things to keep in mind. However, I think this smile looks great, and it would just be at the discretion of the patient on whether or not they want to whiten further. But I think the cleaning did a great improvement. And I hope this video helped you. Please like, subscribe, and turn on your notifications if it did. If you want more information about smoking, whitening, and all that stuff I mentioned in this video, I will link those related videos of mine in the description box below. And until next time, peace, love, and teeth.